My sister,
Why is it recording?
I don't know. Mine is-
What?
What's up with that?
I think Justin joined and is recording.
I didn't expect so many people to be here.
Well, good morning.
How's everyone doing? It's good to see your all's faces.
Doing okay. How are you doing?
I'm here. I'm quarantined until Monday.
I
So
can hear you run on that middle all the way from Stonewall.
That sucks.
Is that you?
Oh, I was just gonna sit here.
I was wondering what that person said, if they were talking to me or not.
Oh, I said that sucks.
Oh, we're talking me, my
Yeah,
situation.
about the quarantine. I about went nuts 15 days in quarantine.
Yeah, it's been a challenge. I went to Kerwin Falls on Sunday, and it wasn't as cool as I thought it was going to be for Henry, but we get out of the house. They're all back at work and in daycare, but I couldn't go back because I had to get my test on Monday. I knew it was going to be positive. Who's on a phone? Raise your hand.
I am. You can't see me.
Okay.
I am.
So what we're going to do today is, let me share my screen here. So I'll email this to you all here in just a minute, but I'm going to go through setting you up on Canvas, and some of you will do it on your phone. Some of you will do it on your laptop, and it'll take a few minutes for everybody. That's fine. We'll just chill out and get that done today. Because I at least want to give you some practice stuff and maybe 2 more exams for the class is over, which over the chapter we're going to cover shortly today, and a final exam, which will just be a culmination of the ones you've already taken so far. And then we're going to look at chapter 17. I saved the,
Figured that's who we were shooting.
let's see here. This one we'll cover on Thursday, let's see. Oh, that's Thursday. Let me fix that typo. So we'll do this one more time on Thursday, and then next week we'll be back. Okay. On Tuesday, the 15th, will be one of our last face-to-face classes. And that's the day I really like y'all have y'all sit down, just take a final paper. And for the rest of this week, you'll be doing practice questions on Canvas, taking an exam if we can all feel comfortable doing it, and there's no pressure on you on it. If not, I can send you a paper copy and let you take it or something like that. But I want everybody, even if you're on your phone, it's a pretty good app to do it on. I think it's real great to take a quiz or a test on, just a multiple choice quiz or test. It works great on the phone. If anybody feels like they need a computer for the end of class, we've usually got some at main campus we can loan out. You just got to sign a paper saying I'll return it. And really, you should take advantage of it if you need one or you think you can do better.
So you want to hit RAUF and get the fuck out?
When I send, also this week, you'll make sure that you're checking your email, because I'm going to start, you might be contacted by a clinical manager saying, okay, let's work on your schedule or get you figured out when you want to come. And I know there's a lot of questions behind it, but just work with them, be patient. If something's not going for you straight, we'll figure something else out. But you should be hearing from them here hopefully by the end of the week. I'm going to start on that today for sure. Who knows for sure they don't have all their vaccinations in? I know Aaron does, and then I was going to review everybody else's charts, but it seems like I did. I just can't remember for sure. Everybody know for sure if they don't have something in?
I have all of mine.
I'm pretty sure that was the case. I just don't have the charts in front of me to verify it. So right now our original end date was 2/17, and I'm planning on it to be 3-3. I'm just going to extend it as much as I can by 2 weeks so we can get a little bit more review and refresh before and some clinical time in there for the class is done. And then you all should be tested on 3/11 now. There's no scheduled dates in March, so I have to get that date added, but that's what I'm shooting for. That's completely up to you. I mean, you can test in a month if you want to. I'm going to make sure everybody's on the same day for initially to test. And then it'll be up to you to decide if you want to change it or something, if you don't feel like you're ready, but everybody should be. Let me ask one more question. Who has, raise your hand if you've went through the NCCT login and made your account and you got your login info?
I did mine.
Okay.
I did mine. I did mine.
So that's a big step we've already taken care of there. Okay, any questions about anything? Any concerns I haven't covered so far?
I had originally planned on that surgery to be February 14th, but where it was supposed, our original test date, I moved it and I don't have a date for that yet. So I may have to test a different date than everybody else.
That's fine, Aaron. Sorry, I couldn't accommodate more.
Okay. I just wanted you to know that I may not be able to test at the same time as everybody else.
Yeah. Even if class is over and you're trying to figure out your testing, you know, I'm still going to be right here for you. You can just pick up the phone, call me or something.
What about the rest of us on the drug test?
Yeah, so I'm going to schedule that for the 15th as well. I'm glad you mentioned that. Tuesday of 15th. So you really want to try to be there on the 15th if you can. Even if I'm, for some weird reason, I wouldn't be able to be there, I'm going to make it happen and have somebody there to be present so you all can come in and at least get that test knocked down and you don't have to travel to Russell County.
Okay.
So one more couple things here about clinical, just housekeeping stuff. Aaron and Mara, I'm planning on sending you to Rock Castle because Aaron, that's where you said you wanted to go a long time ago. And Mara, it's straight up 75 for you, a straight shot to.
That's perfect.
no.
Wherever you go.
I'm going to try to send Kayla and Demi to Somerset, and Rebecca, I'm going to send you to Springview, which is about a 30-minute drive, but Brandy Skaggs, the supervisor there, I feel like that would be a good place for you. Like you all get along for some reason.
Okay.
But that's subject to change, of course, of availability and stuff. But when you're looking at this paper, if you get an email from a Regina at Lake Carmel Regional Hospital or Jason Isley or Brandy Skaggs, you guys got to be vigilant and make sure you're communicating. You know, think professional. I'm a phlebotomy person now. You got to be checking your email stuff and talking to these people. But they're all really nice and easy to get along with. And then if you come up with any questions or something in the meantime, just email me or call me and I will help you figure something out. If something comes up, if you think of a question between now and then, you're just not sure like what color scrubs to get or whatever. And the last thing I really want to make sure is my boss, the new allied health director, has implemented a policy where we're not supposed to be using our cell phones for private text anymore. Like I shouldn't be texting students with my private phone number. So if you email me, I'll get those just as easily as text, and I will respond to you just as quickly. And if you really need to talk to me, that's just fine too. You can call my office number, which I'll put on this paper as well, and it will ring straight to my cell phone. And so I'll pick right up. Doesn't matter if it's the evening or whatever. If I can't answer, I'll call you right back. But just let me know if you need something. Okay, I'm here for you and available to you. But if you text me or call me on my personal cell phone number, I may not answer. Just get the idea. I'm not being rude. I don't want to get fired. Okay, so let's look at chapter 17 shortly. Take that. Can everybody see my screen? See those words on there? Clear enough?
Yeah.
See the phone, folks?
Yeah.
Yes, I see it.
So we haven't covered chapter 17 yet. I'm 99% sure. And there's not really a whole lot to it. That's why I chose it to kind of start our first virtual class. So it's a little bit short and sweet. Look at page 263. $264. All that stuff right there is EKG information. And those questions are not on your certification test anymore. So you don't even have to study about EKG. I wouldn't even waste my time with it. But what else is on here? What you all consider simple glucose testing. So this term POC is just fancy for point of care. And what do I mean by this point of care thing? Well, if you were to go up to a hospital room with a patient laying there and you need to do a blood glucose check on them, which mainly nurses do and stuff, you normally wouldn't be called up to the floor for that unless there was some more blood draw involved with it. But if you're working in the hospital or you're in a situation where you're going to go to a patient and do a test for them, then at that point, whether it's glucose testing or anything that you can get a result right then and there from a machine, then it's called point of care because you're doing it at the point where the patient is. You don't have to take the stuff back to a lab to be analyzed. It can be done right there at bedside. It's also known as this AST. I'm on page 258 right now. And the most common point of care test that you're familiar with right now is glucose testing. Also, we called that a capillary draw. It may seem like a simple question, but somebody tell me what it means to have a capillary draw. What is a capillary? Why are we drawing from that point for glucose? Like, tell me what's going on with that blood and that physiology. Let's kind of remember some stuff. What do you think, Rebecca? Tell me about capillaries.
I have no idea.
What about you, Demi?
I don't know.
Hey, you remember? Does anybody else want to give it a shot for?
Don't we have them in our letters?
Yeah, you got them all over your body, actually. Are
Is
they
it because, I'm
or-
sorry, go ahead.
Are they the smallest or the largest of your vessels?
They're the smallest and don't they have their own properties?
Yeah, they're arteries, and then the next smallest one is arterial.
Yeah.
And then you got this. Let's see here. Let's see if I can get a purple color. Yeah. Capillaries, which are the smallest. And then as your circulation changes, starts to filter through into venules, which are smaller, just small veins, into larger ones like your vena cava, and then it goes through the pulmonary circuit again, and it's the circle of life, right?
Yes.
And so we're talking about stuff right here for most of these tests. This is where the blood draw is coming from. And another just kind of refresher, capillary O2 versus like CO2, you know, blood components and gases that's inside of it. Blood glucose will be a little bit different values compared to these blood that's in these vessels. Slightly different. You'll never know or need to know the difference probably. You just need to know that there is a difference in properties, okay? And these machines are calibrated to take readings from this type of blood. So you can't like, You can take blood from your vein and put a drop on a machine, like to test glucose. I've actually probably done that before, I think, when I was lazy or in a hurry or something for some reason. But you don't really, it's not really considered standard practice, you know what I mean? It's all meant to come from capillary type blood. Here's an important acronym that goes along with these tests, also on page 258. I can email you all this stuff too, like you can look at it later. If I'm moving around too fast or something, just holler at me. I'm probably being a little erratic right now on this program. But this CLIA waiver, I've told you this is an important acronym before. This is the people that monitor your lab and how your lab's doing things, whether they're doing quality control checks. And so they have decided that these tests we're talking about here, these POC tests, are waived. Meaning they're so easy to do and it's so hard to mess them up that people can do them at bedside and get accurate results, like the glucose monitoring machines. Okay, it's pretty hard to mess that up. And so they call it waived. It didn't have to be done in a like a lab with a machine. It can be done right there at bedside with something handheld. You might be surprised about how much stuff we can test with just a point of care. Obviously, glucose is one of them, and probably the next, what I would consider the next most popular is like a PT INR test. Somebody tell me what that has to do with.
Pretty sure.
Control. Neuro.
You know, glucose testing has to do something with sugar in your blood. Tell me what PT-INR is pertaining to, even if it's a wild guess. Look in chapter 2, page 20, sorry, page. Chapter 2, page 19. It's on the left side. You got hemostasis, coagulation in blue there. And you see these acronyms PT, INR, and APTT. Has to do with clotting. You guys know that. Remember now?
Yeah, I do.
But these machines are huge and clunky. I've actually used some. I've had some patients like in the nursing home, warfarin or blood thinners. They'll need to get a PT-INR test like every other day.
Is that because of the blood thinners?
Yeah, they might be
Okay.
too thin, or they might not be having enough medicine, so they're too thick and they're clotting too slow.
Okay.
And so this machine is like a giant glucose testing machine. The strips are really wide and really long. The machine's just a little bit bigger, and the needles that you use to puncture the dermal layer is a little bit bigger. You need a little bit more blood than average you would imagine.
Oh, okay.
Strips are expensive. They're like $5 a piece. So you can't just like, oh, I messed up and throw it away. And oh, I messed up and throw it away. You gotta like make sure you get it right the first time.
Don't have to worry about them.
Go back to my chapter here. There are some chemistry testing. Can you all see my whiteboard right now?
Yes.
No, gosh, this whole game.
You can do some chemistry testing at bedside, but this is usually like you'll see it in an ER or some kind of stat situation, you usually wouldn't take a machine up to the bedside and do a chemistry test when you could just draw blood and take it back down to the lab, right? So there's certain situations where that would be important. Maybe even like third world country or field hospitals or something, you might see it in. And then you can see a box 17.2 on page 259 with just some more for your purview there. In this box, there's an acronym called BNP. Okay. That is not the same as a BMP. Kayla, can you tell me what BMP stands for in a chemistry test?
No, not right now.
You guys don't be nervous.
Like metabolic panel.
Yeah, basic metabolic panel. Its close cousin, the complete metabolic panel, is another chemistry test that's very common. This is actually a test. BMP is for basic. I'm sorry. Nope. Well, there's a brain and there's a basic natriuretic peptide. So peptide is just a protein that's produced from damaged heart muscle. Okay, it's indicative of like heart failure. You can give us some ideas about that. Another cardiac enzyme is called PNT or troponin. We're going to talk more about these here specifically in just a second. Even EKG can be considered a point of care bedside test. Rounding that out, there's hemoglobin. I've had that done with a finger prick before, I think in the Air Force, like during some kind of big line processing when we're getting deployed. Just know overall, these are not everyday things. They're used in different types of settings where a bedside test would be needed or preferable over just a regular, more accurate test. You can see more about BNP. I'll let you all read it later on page 262 here. It's in the same chapter we're talking about right now. This is getting messy. It's been a long time since I've drawn on this thing, so I got to get some practice back in it. Spread out a little bit here. Okay, so page 260, let's talk about these cardiac enzymes for a second. I think this is some neat stuff. I don't know a whole lot about it, but there's two main enzymes you should know about before you go sit down for a certification testing. TNT is called cardiac troponin. And there is a one and another one we're going to talk about. But the difference between TNT and this other one here is basically the time they spend in your blood after they've been elicited by some kind of heart damage. So you'll have a heart attack, muscle cells will be damaged, and they'll start releasing different enzymes. Some of them will be cleared out of your body faster than others. Do y'all remember the time drug under special blood draws when you would draw it at a certain time right here, like say 0-800, you would see a gradual increase as the drug was metabolized, and then it would decrease and come out of your system, and you might need to draw again here 12 hours later.
Yeah,
Same thing going on with these enzymes and the idea with it. And you can read here that in your plasma, it will rise in about a 4-hour window after onset of a heart attack. It can stay elevated for up to 2 weeks. Okay. So you can see why that would be valuable in a situation in the ER or something where somebody's thinking or suspecting a heart attack, or a patient is coming in with chest pains. That can rule out, well, is it a heart issue, or maybe they're just having some kind of respiratory infection that makes them feel like they have chest pain. It can help sort that out for them. I would probably take note that it's in the plasma. There's 3 components for our blood. The other one here is 4 to 8 hours. You'll see a rise after onset of heart attack or myocardial infarction. And it peaks at 12 to 16 hours. Don't get caught up on exactly how long it takes to peak or anything. I mean, everybody's different in that. Just know TNT, is the one that takes a lot longer, 12 to 16. And this one takes only about 4. And if you know this is kind of like the smaller value, this is the larger value, you'll be safe. I don't think there's any specific questions you'll get from me about that. And I don't think they're going to get that specific on your test, but I wouldn't go any further than just trying to make sure I knew the difference between those two after that point. But the idea is to introduce you to these types of enzymes, because this is another test. If you go back and look in chapter 2, that kind of covers all the different types of chemistry and blood tests you can do. These are 2 new ones that you're being introduced to, and 2 new names and starting blood components we could be looking at. Okay, is there any questions? Everybody feeling kind of confident what I'm telling them right now? Right. Really what we're doing right now and for the remainder of this class is just kind of filling in the little cracks with different stuff. You all have a really great foundation, I believe. I'm not too worried about anything for you. And that pretty much covers up to page, well, the last thing we're going to look at here is pages 264, 265, and 266. And these are the ones everybody's familiar with. Get that beautiful rainbow color here. So RSV, who knows what RSV is?
Respiratory.
Yep, my son brings it home from daycare like every month, at least twice, probably gets us all sick. The flu, A and B. We can add COVID to that test now. Because they'll take that swab, they'll put it in some sort of reagent or chemical reactant that's going to tell you if there's a presence of something or not, and get results right then and there. And so a flu swab is just like COVID. You'll swab it, put it down in some reagent, or put it on a little disc like you see at the top of 266, and it'll give you a sign. Can you think of one that's not really listed here that we can also do at home? It's common for people who are the female persuasion. Test for HCG.
Pregnancy test.
Yeah. And actually, that may not even be considered point of care, since you can, no, it is. You can do that. I was thinking that people do it by themselves. Is it really considered point of care? But blood glucose is the same way. H. pylori. Don't be afraid of this word. This is just what causes bacterial ulcers in your stomach. Take Nexium for it if you have an actual ulcer. The way this is discovered is pretty cool. The guy who was convinced that bacteria were causing stomach ulcers actually infected himself with this bacteria, cultured his own, he cultured it himself, so he knew he was infected with it, and then cured himself with antibiotics and presented his findings to, all the great minds roughly around 1990 or so. And that's how we knew, it wasn't until then that we knew bacteria was causing these things in our stomach. They actually didn't even think bacteria could live in that environment. This is what you call a extremophile. So life forms, even if they're single cell life forms that can live in like the bottom of the ocean or near thermal vents or in an acidic environment in your stomach. Speaking of acidic environment, if this is my pH scale, Mara, which one of these is considered alkaline? Which one of these is considered acidic? Which way
I'm
is it?
sorry, I didn't hear you.
If I'm looking at the pH scale, do you remember if it's more towards 1 that is acidic, or is it more towards 14 that is acidic?
I think it's towards 1.
Yeah. So if something has a value closer to 1, it's acidic, and this would be considered alkaline or basic. Bonus question. Aaron, what is an average normal pH for human blood?
7 point, is it like 7.34 or something like that? 3.5.
It's somewhere, I think that's the value, somewhere right in there. I'm very happy that you remembered that. That's awesome. You guys are gonna be just fine. Okay, infectious mononucleosis. I think that's the kissing disease. Or what was that? That is the virus. That's what it's called when you're in middle or in grade school. Somebody's home for 2 weeks. They got the kissing disease.
Mono.
I had it like twice.
I remember one guy named Kevin got it when I was in school. I never had it, but you can get it from like towels in the locker room and all kinds of stuff. Makes you really sleepy.
You also test positive for it for the rest of your life, basically. Like if you could get it again after you have mono once, but they can't tell you for sure if you have it because you're always going to test positive for it.
Yeah, sort of like, well, I guess TB you can actually confirm with a chest X-ray. But okay, that's it for lecture. You guys want to take like a 5-minute break, and then I'm going to send you. We're going to sit here and chill out while I send you some emails and see if you can get registered for this website.
Sure.
Okay.
Okay.
Let me stop this recording too. I think I would be a Zoom expert at this point.